Hello, everybody, and welcome to our webinar this morning, where we have Corinne Dunningham from Trobe University. Corinne, a very warm welcome to you. We're very excited to hear what you've got to share with us today. So, Corinne, you're a senior lecturer and course coordinator in the Master of Nurse Practitioner. So I think this is a really interesting one. This is an area we have not covered before, Corinne. So I know a lot of people are interested to hear what you've got to say. And you're at the Alfred Clinical School at La Trobe University. So,
Yes, yeah,
Corinne,
correct.
I think the other thing I wanted to say about you, and then I will let you have a little say about yourself as well, is that I think from everything I've heard from your colleagues, you are a fierce advocate for great student experience and outcomes, which is exactly the type of academic, of course, we all want to see in our universities. And we at Quitch love to work with people like you. So also a warm welcome to our audience this morning. The session will be recorded, and please, if you do have any questions for Corinne or myself, you can pop them in the Q&A tab at the bottom and we will get to them at the end. So Corinne, I'll hand over to you and let you maybe tell the audience a little more about yourself, and then off you go. Thank you.
Thank you so much, Grania, and hello to everyone on the webinar. As Grania had said, my name is Corinne Dunningham. I'm an emergency nurse practitioner and a senior lecturer and course coordinator for the Master of Nurse Practitioner at La Trobe Uni. I do apologise for my voice. I'm just overcoming a bit of a chest infection, so I don't normally sound like the cast of the Muppets, but we'll get through today. I'm here to talk to you about my experience and with using Quitch this semester with our students in our Master of Nurse Practitioner program. So our program is an accredited course through the Australian College of Nursing and Midwifery Accreditation Council, or ANMAC, and the Nursing and Midwifery Board of Australia. We provide educational requirements for eligibility to apply as an endorsed nurse practitioner through the APRA. And nurse practitioners are advanced nurses with knowledge in pharmacology, quality use of medicines, prescribing, diagnostics, and diagnostic decision making. Essentially, what that means is we can see and treat patients either autonomously as a nurse practitioner or in collaboration with other healthcare professionals, allied health, and our medical colleagues. For the use of Quitch, we used it in our subject NSM5TMB, which is our pharmacology subject. And SM5TMB is quite content heavy. So anything pharmacology when it comes to drugs, and pharmacology, for those who don't know, is the study of what drugs do to the body and what the body does to drugs. And when we talk drugs, I'm talking medications mostly. And it's very scientific based. So something that is a little bit out of the realms of, we do learn some of it in our nursing courses, but when it looks into that prescribing and needing to know that increased depth, it is very scientific based. And there are so many medications, drugs, herbal medications, vitamins, minerals, all of that out there on the market. There's just so many of them and changing every day. So it is a very content heavy subject. My students are a mature age cohort. So we are an advanced nursing degree. So most of my students have done a previous diploma to get into our course. All of our students have to have. And so we're on about the second or third postgrad by the time they come to us. And a lot of them are returning to study after a prolonged period of time away. And because we are a mature age cohort, there is that increased work-life study balance. They have family, they're generally in advanced or higher positions within the hospital, so increased workload than they probably would have previously. And, you know, life is harder when you're in your middle age. And we do have quite a large student cohort. So previously, in semester one of this subject, we had 15 students. In semester two, we had over 100 in this subject. So it was a significant increase in numbers, which meant as a lecturer, I had a decreased ability to know the progression of my students as well as I would have in that smaller, more niche cohort. And to build practice quizzes in learning management systems takes a lot of time, and time was not something I necessarily had with over 100 students in a subject to be able to build all of these. And then there were some actual scholarship of learning and teaching concerns that I had in regards to this subject as well. So because of that content heavy, the cognitive load, both extrinsic and intrinsic to the students, was something that was really, really concerning for me. We have quizzes as part of our course, and I certainly know when I did my pharmacology, exam anxiety was massive. And it is a known phenomenon across most areas that have a quiz or an exam, that you get that performance anxiety and stress about that. Because our course is 100% online, there's also the transactional distance concerns with the fact that I can't be there with the students at all times. And how could we help bridge that in a different way than me constantly being around? And also how with a cohort of 100 was I going to be able to early identify at-risk students to decrease their chance of failure rates. In pharmacology courses in general, and this is out in the literature, there is higher percentage failure rates in pharmacology courses across different specialties. It's not specific to nurse practitioner. It happens in medical, pharmacy, anyone who does a pharmacology course just because of the content load. And so this was something that I was really concerned about, is I didn't want to set students up for failure. And then Quitch came along as a ability to pilot, to see, is this something that's going to be useful to our students and to help with some of the issues and concerns. So kind of what I thought were going to be hopefully the best bits about using Quitch when it came to the students was that I was going to put some of my more boring content in a fun way. It was ability to practice exam-like content in an approachable way. Identify areas of strength and weakness for the students to allow them to focus their efforts among the large amount of information that they've got to be studying. They can kind of spend their time a bit more on the stuff they don't know. And for me, if we were going to do something that was readily available, the anonymity was really important. The freedom to practice without any prejudice or stigma, because I'd hate for students who were feeling like they're struggling to get onto something that told everyone they were struggling, and then they had to continuously practice, and it would have disengaged them rather than engaged them. For me, what I hoped were going to be the best bits were a quick way to design and develop quizzes, and support. I'm fairly new to academia. I've only been doing this a little over a year. So support with the appropriate language of how to build a quiz. It's not something I've needed to do in my nursing career before. To make sure that the outputs from the Quitch quiz bank are similar to previous quizzes, and hopefully that would mean we're making academically sound questions. And again, that decrease in transactional distance was something that I wanted to make sure we were looking for. The actual best bits I found were some of these. So for when you use Quitch and you put in all of your prompts and upload your presentations and stuff, these fun little pop-ups come up while they're putting together the quizzes, and I really enjoyed when they popped up. So it was something that was very fun. But in all seriousness, the actual best bits. So 91% of our learners enrolled in using Quitch. There was good retention throughout the weeks preceding the exam. There was a spike very high before the exam itself, and then it did drop off a little bit. But some students have still continued to use Quitch, even though there is no longer exam content for the rest of the semester. The students were asking for Quitch in more of their subjects, and to me, that was the bit that went, they're really engaged and they're liking this. So this was something that was exciting to see. And also the traffic light system that's part of Quitch. So being able to see completion, accuracy, time spent for each student, in addition to highlighting the individual questions and part of the content that we're building in the green, orange and red, and actually all shades in between of how the students were doing with those specific questions. And what that allowed me to know is, have we missed portions of content that I need them to know based on the questions I want them to answer? Have we actually not highlighted that content in our week to week? Have we not spoken about this in lectures? And it was something that I could keep an eye on to go, oh, we're all getting this one question wrong. Maybe we need to talk about this, or maybe we need to highlight this a little bit harder. So it allowed for that quick overview of the underperforming students, and we knew what to put an effort into leading up to the exam. Or we could lead students to the resources that would best support their development in a particular area. The anonymity was definitely something that was part of the best bits, and the students not feeling concerned about being judged if they're wrong. It definitely wasn't hugely reflected in the student worries, and maybe I'm just being a bit overprotective. But for me as a lecturer, this was my concern. But I was also glad I could see the actual names, because the three-part made up name, I wouldn't know who's who. So it was good that I could see their actual names to pinpoint students. And anecdotally, when we did set up Quitch initially, the students did state that picking their screen name was enjoyable, but also something that they worked very hard on. So they did enjoy that process. The return on the investment was great. The quiz performance or success, and decreasing cognitive load factors, and the ease of use. Now, this was once I worked out the prompting. Because I've not worked with AI before, and I am an academic that does a lot of journal article searches, I was putting in more keyword searches rather than proper prompting. And I have to admit, the first quiz came out looking like an 8-year-old wrote it. But with some support from the Quitch team and also just a little bit of trial and error, once I worked out the prompting, the quizzes that were being developed were of that really high standard, which was exactly what we wanted. And once I had worked it out, I got about 5 weeks of quizzes able to be developed and reviewed within an hour. So that was pretty good timing once I got the hang of it. And it didn't take as long as it probably sounds like it should. So post-Quitch implementation, it's a bit difficult to measure because we had not had a comparable pre-implementation quiz with this group of students. However, between quiz 1 and quiz 2 is when we started using Quitch. So quiz 1 was in the second week of their semester, and they had 20 multiple choice questions from 2 weeks worth of content. And then quiz 2, which was after the implementation of Quitch, was 70 multiple choice and 3 short answers based on 9 weeks of content. What we found just comparing these two quizzes was that those who were anything under 80% in quiz 1 achieved a higher result in quiz 2. And the largest jump we found was a student who went from 35% to 83% between quiz 1 and quiz 2, which was an incredibly high jump in that cohort. Anyone who had achieved over 80% in quiz 1 did drop slightly, but that could be just due to the fact it was 2 weeks worth of content versus 9 weeks, and quite a significantly different quiz itself. The really important things is the student feedback. So the students had said it made learning fun and also gave me an understanding of the depth of the knowledge required for the exam. I found it really helpful as it was prompting me with reading that I could find out more clearly about my weaknesses in the subject. It really helped me get more understanding of pharmacology and relieved my stress about the exam. I could get more confidence from Quitch. And the mobile app was more accessible. I could do some revision whilst breastfeeding my baby, very useful for a busy mum to snatch moments. And this was the part that I think for me was the measurable point, the confidence that the students had in the material, the fact that because they built that confidence, they engaged more with the material, which then allowed them to gain that understanding they needed to pass their exams, but also to synthesize that knowledge moving forward within their career. This is something that is fundamental to the work that we do as nurse practitioners. And so understanding what is quite a large subject, and for some of us as we have gone through, we remember a bit of the terrifying part of pharmacology, but not necessarily always the knowledge that we learnt. And so to take away that bit of terrifying portion, that was really, really important to me. And that's my kind of presentation so far. And does anyone have any questions?
Thank you, Corinne. Yeah, while I'm waiting for people to pop some questions in there for you, there was a few things that really stood out to me, Corinne, which I thought was amazing. One was your 90% uptake. That's huge, huge level of engagement and uptake. Our uptake is one thing, but then the fact that they continue to use it for practice and so on. And I also really like the point you made about, because which I've heard before as well, students feeling safe. So if it's taking me as a student 20 times longer than you, Corinne, to understand something, nobody needs to know about it. I can safely practice in my own time as long as it's there and available for me, which, as we know, Quitch is built on that growth mindset. So the idea being it's available to you as long and as often as you need it. The other thing I liked, Corinne, was you talked about the guidance on in terms of the issue with content from the cohort, so that you could then navigate that and you knew in real time where the issues were for the cohort, so you could actually, going into the exam, focus on what the student needs, rather than us dividing our material up evenly as we often do. And I loved the fact that you talked about confidence and engagement as well. That
Yeah,
was really good.
the
Yeah.
bit that I used that overall traffic light system. So pre-quiz, I sort of built a practice quiz recap of all of the week's worth of things. So we did a quiz recap, and it was extra questions based on what we'd be asking them, like similar what we'd be asking them in the quiz and what we want them to know. And it was really good to kind of go, well, did I need to focus a few more questions on some of those that were in the, darker orange to lighter red colors, or, if they were in the very green colors. I had one or two questions scattered throughout that practice quiz, but I felt fairly confident that there was, a decent uptake that wasn't going to be too much of a problem. The other thing I did forget to mention is we do have endorsed midwives who come through this course as well to learn their pharmacology in preparation for becoming endorsed. So they're midwives at the moment and are planning to be endorsed midwives. So having that interdisciplinary kind of discussions and being able to pitch it at a level that isn't assuming that you have the basic knowledge of a nurse or a basic knowledge of a midwife, but you're actually looking at those concepts across that spectrum, was also something that was really helpful in having this and allowing me to contextualize what I'm wanting them to know based on based on the concepts, and because their patient cohorts are all very different across the spectrum.
Interesting. And then I think the other thing what's interesting for me was you talked about the cognitive load, how students reported that it just helped to remove the anxiety, the fact that they had all this ability to be able to practice and so on, just reduce that cognitive load, which, let's face it, is a huge, huge thing.
Yeah, and it's not something I can't remove the content. I can't make there be less medications to learn about. If anything, we're getting more and more by the day. But what I was able to do was just adjust something to help support that load. And so anxiety and stress can increase that intrinsic load for the student. And that is something we could have an effect on by doing this. I can't change the extrinsic content of my course, but what I can change is just how to decrease some of those extra factors that will compound that cognitive load.
Yeah, that's exactly those that compounded is right. Corinne, I do have some questions for you. How did you encourage students to start using Quitch and stay engaged with it throughout the semester? Because your engagement level and so on is very high.
Yeah, so I didn't actually have a lot of trouble getting them started on this because they had already gone through quiz one. Their anxiety level was quite high. They were asking for more questions, more things to practice for this next exam. So when I said, yep, we're working on it, and hey, look, here's Quitch, try this. It's going to have some practice quizzes. They were all on it like a shot. So the uptake was, I think, that intrinsic and extrinsic motivation of the cognitive load really put them onto this. The engagement throughout was being able to, now my students, a lot of them wanted all the questions all at once so they could practice all the time. I thought that may have been increasing the cognitive load as well. So I did release them kind of the fortnightly material the weekly material as we were going. And look, some appreciated that, some didn't. And it's something I'll take back from their feedback to me. But being able just to have that content released kind of at a periodic time, I think kept them engaged enough to be like, okay, well, there's more coming, I can practice more. And then, as I said, I built a really kind of I think it was a 5-part, pre-quiz, let's try this out, things we might ask you in your quiz. And that they really kind of went through that again, quite similarly. And there was that massive spike in uptake, I think, the week before the quiz when we put those out, because they were like, okay, well, this will just consolidate my knowledge. But a lot of their motivations actually came from themselves. Once they started to get to use it, the things they enjoyed. They enjoyed the gamification and the badges and the names and we're a competitive bunch. Those who go to any higher level degree, we've got that certain type A, let's get things done type personality. So I think there was a bit of that as well. Certainly, but it was also that I think they could feel the benefit out of it. And that seems to be what kept them engaged. I had hoped we would get more of an engagement post the quiz, but at the same time, it was a lot to get them through to what it was and the content that they've engaged with and keeping that sustained for the time. So it isn't unnatural that they've dropped off significantly since the quiz is finished. But they have been asking, can we have this in a different subject that doesn't have quizzes? So I think it is something that they are seeing the value of outside of the exam prep. And that is something that certainly came back into feedback of could we have had this in a different pharmacology or quality use of medicine subject, which doesn't have a quiz at all throughout it. So I think that just engagement with the content is something that they've really seen helpful with this. And it's something that we can take on board continuing of using this outside of a quiz-based practice format.
Yeah, I think you're right. I think that to me says, Corinne, and I have heard that it's consolidating knowledge. It's not necessarily that, it's just that they're going to do a quiz and an assessment, but it's a way for them to identify really clearly what they know, and more importantly, I guess, what they don't know through that personalized feedback with the traffic light system that they get. So I think that's a great outcome. Yeah, absolutely. I've got another couple of questions for you. We've got a few more minutes.
Mhm.
One of the, and you did talk about this a little bit, but maybe if you could expand on it more. Have you noticed measurable changes in student performance, confidence, or participation since introducing Quitch?
Definitely the confidence is something that has increased. The performance, as I said, we didn't have a good kind of like for like measurable. So if you look at it overall, we did have a slight decrease in the percentage from quiz 1 to quiz 2 because 2 weeks of content, most students got 90, 80 and above percent on their assessment, and they probably got in the quiz portion somewhere between anywhere between 60 and 95% in quiz 2. So there was that natural drop just due to the volume of content. And so I think I don't have anything empirically to say statistically significant changes, but what I did notice was in looking at those numbers, those who had the lower marks, so those who were the more at-risk students, they were the ones who performed a lot better in quiz 2 and post-Quitch implementation. Now that could be, part of the fact that the students had seen that they needed to put more effort in from quiz 1 to quiz 2, and this was something intrinsic to them. I'm not saying that, we've solved everything by Quitch, but certainly I think it was a tool that they were able to use as part of their study kit to be able to support them along with that. And certainly from a lecturer perspective, it was something that I could do in a big group that I couldn't have that same one-on-one contact with the students that I would have in a class of 15 that I do in a class of over 100. It just isn't possible for one human to have that many kind of connections with the students. So that was the bit I was worried about, is losing that one-to-one connection that I had with the students, and how could I still make sure that I was keeping on track and supporting them. Now, I'm also very lucky. My student cohort are very open and communicative with me. We have great two-way communication systems. So I do ask if they're struggling, please to reach out, and they do. But we can't guarantee that we're going to see that from every student. Some students just don't feel comfortable admitting that they don't feel confident. So this allowed those who maybe were either feeling a lot more confident and maybe that conscious incompetence or conscious competence was there as well. And so they were able to go, okay, well, I don't know as much as I thought and I can practice more. But also those who knew that they didn't know things but weren't happy to reach out, it gave that ability for them to have a safe space to practice, to be able to build that up.
I think that safe place is so important, Corinne. Corinne, we do have another question from the audience for you. It sounds to me the engagement of students was helped by the relevance of your questions. Can you explain a little more about how you prompted the generation of the questions?
So it was about, so I learned that you need to write sentences for prompting, and to give them pretty clear directions about what you need the AI to do. Um, Given that most AI is built in America, or is kind of American based, knowing that I needed to put utilization of, so use Australian drug names only, Australian medication names only, that was really important to note so that I was making sure it's contextualized to Australian drugs. And so we weren't learning about acetaminophen, we were learning about paracetamol, we weren't learning about epinephrine, we were learning about adrenaline, those type of things. So making sure that we were having the correct terminology. Um, you were able to upload a lot of prompts to the prompting section. So I was able to be as specific as possible. So I'm asking about, and it understands that higher terminology. So I was able to put in, create a quiz on the pharmacokinetics and pharmacodynamics of non-steroidal anti-inflammatories, focus on absorption, distribution, metabolism, excretion, avoid drug names, use medication classes only, and then I could put the silos or kilos in if I needed to. I could upload my lecture content as well. So it could pull from that to see if there's anything from there. We actually uploaded case studies. So I gave them and then utilize the following case and put the case in. And then it would develop those questions based on the case, based on the prompts we had asked them to put in. So the more prompts you give them, the more specific it's going to be. Sometimes it got a bit over specific and it threw out some things that even I didn't understand. So, but the easy part is we have to still validate it and look at it before it's published to the students. So for something that I'm like, I don't even know what the AI is trying to say, get rid of that question, we can build another one. And so that's, I think, the good safety portion is that if it's not something that we understand, then or it's building something that doesn't make sense, we have that ability to look through and get rid of it. The other kind of validity thing that we found out was that our quiz was prepared by our pharmacist, when it came to the quiz the students got. And I was the one building these quiz questions with Quitch. And they and they were done completely separately. So I didn't see the quiz before it was published, and Quitch had been going on for a few weeks before the quiz was published. And the questions matched up quite nicely. So we know that from a real world, academic writing the quiz versus what Quitch was giving us, they matched up very well. So we know that it met the AQF levels. We know that it met the real world need for the students and what we need them to know from a clinical perspective, because there's our clinical pharmacist who was writing this, and they are our resource that we go to for all things medications related. So that to me was also the really helpful portion, knowing that we were academically sound.
Fantastic, a great answer, very detailed. And I think for the audience there, you're welcome, of course, to have a play with Quitch. And as Corinne said, it is a bit of trial and error with the prompting, but we have a really good prompt engineering engine for you now. And as Corinne said, you can also upload all of your own materials, use those to create the questions, and you can also, of course, get some external resources if you want them as well. Corinne, we have run out of time, and so I just want to say a huge thank you from behalf of all of your students, firstly, for all of the commitment you put in place to make sure that they do have a great experience and that you do get great outcomes for them. You're very open and welcoming as an academic, I also hear, and so that two-way communication, I think, works really, really well. But thank you so much for sharing your story with myself and the Quitch community and the audience today. And I'm sure, Corinne, is it safe to say if people in the audience have further questions, they can follow up with you afterwards?
Yeah, absolutely. Please do reach out.
Great. Thank you so much, Corinne. We really appreciate it. And thanks
Thank
to
you.
the audience today as well. They're a great presentation, Corinne, we're hearing from the audience. So thank you very much.
Thank you.
Bye now. Thanks so much, everybody.